and how it will be effective and what are the advantages and disadvantages. We will be looking into these things. So today's topic is routes of drug administration. The routes of drug administration can be broadly divided into enteral, which is in the form of oral tablets, and enteric-coated tablets, and parenteral, that is in the form of injections, inhalations, transdermal and transmucosal methods, and the local applications or topical applications such as the drugs which can be applied on the skin and the drugs which can be applied on the mucous membranes. Here we see the images of the various routes of drug administration such as oral, transdermal, transmucosal injections as well as the topical ointment forms. In today's class, we will be dealing about the enteral route of drug administration, and this will be discussed in detail for you all. The enteral route is the most commonly used and it is the oldest and safest route of drug administration. The large surface area of the gastrointestinal tract, the mixing of its contents, and the differences in the pH at different parts of the gut facilitate effective absorption of the drugs given orally. So, under the oral administration, it could be swallowed or it could be kept in the sublingual area or it could be kept in the buccal area. But ultimately, these drugs are going to reach to the stomach or its contents are going to go into the intestine from which it is going to be absorbed. Okay, so here what is happening is the drugs are going to go into the stomach. It is going to get disintegrated into smaller particles and then it is going to be absorbed into the intestines through and from which the mechanism of action is going to take place. The advantages of the enteral route is that it is the safest route because you don't have to make any puncture on the body or you don't have to insert it anywhere. Okay, so directly you can just take a glass of water and take the medications. Therefore, it is the safest route. And why it is also is known as the safest route is because it is the natural opening which is present in our body from the mouth to the stomach to the esophagus. Then there is a natural connect of the gastrointestinal tract through which we are taking this drug. It is also the most convenient method for many of the patients, especially those who are conscious. And it is most economical. Why? Say, for example, if you take a saline bottle, that might cost you around 200 rupees or 100 rupees, whereas a oral tablet will cost you around 5 to 10 rupees per tablet or even lesser than that. One more advantage is these drugs can be self-administered. That means there may not be the supervision of a nurse or doctor. So if this has been prescribed by a doctor, that can be taken by the patient himself at the convenience of their house. And as discussed, it is one of the non-invasive routes because there's already a natural route which is present in our body through which it is being taken. The disadvantages of the enteral route is the onset of action is slower as absorption needs time. Why the absorption is taking time? Because first of all, the drug has to be broken down and then only it can be absorbed in the body. It is the same mechanism of action like if you are taking any food which goes into the stomach, it has to be broken down into smaller particles and slowly it will take time for the food to get absorbed into the body. So the normal time which will take is 2 to 3 hours. Okay. Same way when the drug is going into the stomach, Even though it is small, it will at least take a minimum of say half an hour for it to get absorbed. Then it could be in, for example, irritant and unpalatable drugs cannot be administered through these drugs. Those which can cause the irritation to the mucosal membrane of the mouth or the esophagus, where it could damage the esophageal linings, these drugs cannot be given through the oral route. Some of the drugs may not be absorbed due to certain physical and chemical characteristics. This depends on how the drug is being prepared. For example, streptomycin is not effective orally, and it could also cause the irritation to the gastrointestinal tract and can lead to the vomiting. So there is no use if you take the drug and then you vomit it out, right? So we have to ensure that the drug is not causing any gastrointestinal tract irritation. There also might be irregularities in the absorption depending on the personalities of the um, person. If he is having any other disorders, say metabolic disorders, so there might be some irregularities in the absorption of the drug. Some of the drugs might be destroyed by the gastric juices. So, what happens in case it is getting destroyed by the increased amount of gastric juice present in the stomach? So, there will not be the effective use of the drugs. So, maybe very small amount of the drug is released into the body, and the effect of the drug may not be as what is expected. And oral preparations cannot be given to unconscious persons. So, this is also one of the disadvantages of the enteral route. Next, we move on to enteric coated tablets. Some of the tablets are coated with substances like cellulose acetate, gluten, phthalate, etc., which are not digested by the gastric acid but get disintegrated in the alkaline juices of the intestine. So here we can see what is the difference, why it is not getting disintegrated in the gastric juices is because it is in acidic nature, whereas these drugs are formulated in such a way or prepared in such a way that it will get disintegrated only in the alkaline juices of the intestine. What are the advantages of enteric-coated tablets? It will prevent the gastric irritation. It will avoid the destruction of the drug in the stomach. It will provide the higher concentration of the drug in the small intestine. It will retard the absorption and thereby prolong the duration of action of the drug, and the frequency of administration may be reduced. So, these are the advantages of enteric-coated tablets. Moving on to the disadvantages of enteric-coated tablets, there may be failure of the preparation resulting in the release of the entire amount of the drug in a short time, leading to toxicity. This could be very fatal in case the drug is not prepared properly and a large amount of drug, especially if it is in a capsule form or in the entry-coated form. So what is happening is once it reaches into an intestine, the entire amount is getting released, and that much amount of drug is not required for the patient. It could lead to fatality of the patient. It could also be fatal for him. So the right amount of drug is needed, and that has to be kept in mind. Anti-coated tablets are also more expensive compared to the normal oral tablets that you get in the medical stores because of the anti-coating substances which are used to coat these medications. Moving on to the nurse's responsibilities when you are giving the medications through enteral or oral route is the capsules and tablets should be swallowed with a glass of water with the patient in upright posture, either sitting or standing. This is very, very important. The person has to be in upright posture, either in sitting or standing position. Recumbent patients should not be given the drugs orally, as some drugs may remain in the esophagus due to the absence of gravitational force facilitating the passage of the drug into the stomach. Such drugs can cause the damage to the esophageal mucosa. The examples of such drugs are iron, salts, and tetracyclines. Okay, so it is very important as a nurse that we keep these points in mind, that when we are administering the medications, we make the patient to sit in an upright position and then only administer the drugs. And in case of a patient who is unable to get up and sit by himself, we have to elevate the bed to an upright positions of 90 degrees, and then only be administering the drug. So the important questions which could be asked from this topic are: mention the routes of drug administration, discuss the advantages and disadvantages of enteral route of drug administration, which could be a 10-mark question. And the other question which could be asked is: write in detail or just entry quoted tablets, that can be asked for 5 marks. The remaining topics about the parenteral routes and the tropical routes will be discussed in the next class. Thank you all for watching. Please subscribe, like, share, and comment regarding how the class was. We will surely improve and make it effective for all of you. Thank you.